Hi, my dear doctors. Very, very warm welcome to this winning preparation plan, which we have tried from our side for you. Maybe this small initiative from our side might help some of you in preparing in the last 14 days. With me, Dr. Amit Gupta, sir, your favorite loving OBG faculty. Myself, Dr. Vineet Gupta, we are just here to share with you that what are the questions which are coming in your mind, that what you need to do in these coming days. So let us have a look at the questions, what we have received from your side. Now, these are the few questions. What to study, how to clear the confusion between whether we should focus more on the revision of notes or focus more on the MCQs or on the chanting or on the revision videos or on something which is giving you more impetus. Another important question what we are having is how to remove the fear of not able to remember in the exam, or how we are not able to remember at this point of time. And the most important question, my dear doctors, what we both have been discussing with each other also, that many of you are still thinking that will I pass? So Amit sir has done a wonderful job for you. He has highlighted few very, very important things, and probably this is going to pump you up that yes, you will pass. Nobody can stop you. So I would just like to share with you that what we need to study at this point of time. My dear doctors, we know we are just 14 days away. Prioritize and perfect planning is going to be the key for this 14 days. And we should know that what the examiner is going to ask on 12th of December. If we take a look at the past experiences, if we take a look at the subject-wise distribution, what NBE has given on the website, we know that distribution of subjects is somewhat like this. Like anatomy, physiology, biochemistry, they say there are 17 questions, pathopharma, micro, 13 questions, forensic, 10 questions, PSM, 30 questions, ENT, ophtha, 15 questions each, medicine, 33, surgery, 32, OBG, 30, pediatrics, 15, orthopedics, 5, derma, 5, psyche, 5, radio, 10, and anesthesia, 5. This is the distribution as per NBE. But what we have analyzed with our past experiences of so many years with all of you, beta, that the examiners are trying to focus more importantly on few subjects, the yellow highlighted subjects, what you are seeing here, like pathology, forensic medicine, PSM, ENT, ophtha, surgery, radiology, and obs and gynae, right? Now, I would just like to tell you that when we are analyzing the different exams, PSM, surgery, and gynae, we know they are going to contribute approximately 100 questions for you in the exam. So please be fully confident in this PSM, surgery, and gynae. The second most important thing what we need to do is we don't have to miss out on ENT and ophthalmology. Also, anatomy, pathology, forensic, radio, these are going to be the key subjects. And when me and Amit sir were discussing, then Amit sir shared an important input from his side that since in the last 14 days, we also have to be very, very smart that what are the areas where we are going to give less input and we are going to derive more output. Right, my dear doctors? So less input and more output. The yellow highlighted what you are seeing, they are going to be the key. The blue ones, they are important, but they may require more amount of input versus output. So be careful there, but yes, they are important. And the other subjects, generally what we have seen, the changing pattern of examination, the current examination, the last 3 exams, the number of questions are quite less from these. However, derma, ortho, radio, the image-based questions are given a lot of weightage. The basic subjects, especially if I talk about anat, physio, and biochem, they are more clinically integrated. The applied part is something what is commonly being asked in the exams. Yeah. Now, one thing which I would like to emphasize is that what we need to do at this point of time, whether to go for the notes or to go for the MCQs or to go for clinical orientation or to go for chanting or to go for any other thing. My dear doctors, we both firmly believe, and the entire team MIST believes, that since you have put in a lot of efforts till now, just try to capitalize on the main forte, what you have done, what you are confident with. No new content should be taken at this point of time. Whatever you have done, just revise that nicely. Notes are going to be the key for you in the exam, plus practice of solving the MCQs, plus the clinical correlations, the integrations, and the holistic approach that is going to help you out. Now, if we take a look at how we need to study at this point of time, we need to divide our day. Chunk down. Yeah. So Amit sir has rightly pointed out that we have to chunk down our daily study time into short bursts like 2 hours, and then after every 2 hours we should take a break. And what they should do in the break, sir?
You can have tea, you can have coffee, you can have few almonds or walnuts or fruit of your choice. You can even have a chocolate. But what I would like to advise you during the break, just keep your mobile away, close your eyes and relax yourself for 10 minutes. It's going to charge your battery for next 2 hours. So chunk down your targets into 2 hours of study, then definitely take a break for 10 minutes. Otherwise, what's going to happen, beta? If you keep on studying, if you are going to study for 6 hours or 7 hours, see, you won't retain actually. This retention is very important because ultimately we are making daily targets now. In this 15 days, we are making daily targets. And at the end of the day, at the night, we should be able to achieve our daily target. And when we are making daily targets, we are writing our targets one day before.
Yeah.
Either in our 4 notes or in the copy pen, with the pen on the copy, that we have to achieve this target. And next day, we'll celebrate it, no? At the end of the day. And by chance, beta, at the end of the day, during night, you are feeling that I say revise for 12 hours. But I'm not able to memorize the whole thing. Then what has to be done before sleeping?
Re-revise.
Re-revise. Re-revise it for 30 minutes or 1 hour. And believe us, you are going to retain like anything if you are re-revising the whole content, whatever you have revised during the day. So chunk down your target and celebrate in the breaks.
Wonderful. Wonderfully said. Divide your day into practice where you are focusing on the notes for 80% of the time and 20% of the time you are devoting for the MCQs. And my dear doctors, last 1 week before the exam, what we need to do is, you know, you're going to appear for the exam, the paper 1, 9 a.m. to 11:30 a.m. So try to devote 1 hour between 9 a.m. to 11:30 a.m. on solving the MCQs so that you develop that habit, especially in the last 1 week, right, beta? Also do the same thing between 2 p.m. to 4:30 p.m. Devote 1 hour for solving the MCQs. So that will become an inbuilt habit inside you. In the break time on the exam day, what you are going to do, beta? Like 11:30 a.m. to 2 p.m. You will be focusing more on revising the single liners things and you would be looking at the images. So even in the last
They
1 week,
can do 1 week before.
yeah, they can start practicing this 1 week before the exam. So 11:30 a.m. to 2 p.m. read one-liners and images. That is going to help you.
And quickly read that, quickly read, as you will be doing during the exam day.
Yeah.
And try to have similar kind of meals also.
Yeah,
Between
that is
11:30 to 1, have similar kind of meals and quickly read the thing. Maybe one-liner book. They can even use all-in-one and to revise during that.
Yeah.
That's really going to help you, So acclimatize yourself according to exam day, specifically 1 week before examination. You have to start it at least 1 week before exam day.
Wonderfully said. And the last 3 days, what you have to do is you have to keep for the volatile subjects. Like we know, micro and pharma are a little more volatile. So try to revise them. Suppose 12th is your exam. Then 9th and 10th of December would be the ideal days for these volatile subjects. Also, beta, apart from pharma micro, if you feel that there is some more subject, maybe psychiatry or any other subject where you are lagging behind or you are not able to remember it, so try to give due respect to that particular subject on 9th and 10th of December. And also, my dear doctors, the highlighted points which you have marked in all the subjects, the points which require repeated cramming. Despite cramming, you are not able to recall. Despite cramming, you are not able to recall. So that is going to be your forte on 9th and 10th of December. Those points, right? And just before the exam, the day before the exam, 11th of December, focus more on the image-based revision so that the images are quite fresh. And as per our experience, the subjects like radiology, dermatology, orthopedics, surgery, ophthalmology, pathology and PSM are having good chunk of images. So please do not miss out on that.
And along with that, they can go through staging and treatment of various cancers the day before exam. That's really going to help you a lot. You'll memorize that during exam day because these are volatile areas and we keep on forgetting. And as we discussed, we have to chunk down your targets to 2 hours and achieve and celebrate in break. Like you can have tea, coffee, almonds, walnuts, or chocolates. And avoid fried things, beta. You have to avoid fried things because if you eat too many of pakoras, pakodis, and fried things, that make you feel sleepy.
Absolutely.
And then you will unnecessarily sleep during the daytime. And now onwards, beta, never sleep during the daytime. Never ever sleep. Otherwise, what will happen? You will feel sleepy during examination hall.
True.
During exam day. So don't sleep in the day. So you have to avoid eating fried things. And don't use yourself as a machine. We only are human beings here. इंसान है हम लोग. Machine की तरह से. What we are doing? We start studying. Then we keep a clock here. We'll study till 6 hours, 8 hours, 9 hours. And then, यार मजा आ गया यार. हमने 9 घंटे पढ़ लिया. पढ़ा क्या? I studied for 9 hours. I studied for 8 hours. What did you study actually? So chunk down your target. Just study for 2 hours. 2 hours, 2 hours. Then celebrate these 2 hours with a small break of 10 minutes. And I would like to tell you one thing. जो संघर्ष से डर गया वो मर गया. अपने समय से कभी शर्म मत कर. Many students are sending messages. Sir, we are passing through the worst time of our life. We are passing through the worst phase of our life. Some are having some financial problems. Some are having some social problems. There are some emotional crutches. लड़ते रहो. लड़ना तो पड़ेगा. You have to fight. We have to be fighter. लड़ना तो पड़ेगा. अब चाहे हंस के लड़ लो, चाहे रो के लड़. आदत तो डालनी पड़ेगी लड़ने की. या तो रो के रिवाइज कर लो या हंस के कर लो. अपनी लड़ाई खुद ही लड़नी पड़ेगी, चाहे तुम्हारी दोस्ती भगवान से क्यों नहीं हो. अर्जुन की दोस्ती भगवान कृष्ण से थी, लेकिन लड़ाई अर्जुन को अपनी खुद ही लड़नी पड़ी. तो ये 15 दिन बेटा, ये 15 days, these 15 days can turn anything. Many students are sending messages that, sir, we couldn't study for last 3 months because we didn't join any institute or whatsoever. I don't want to go in that detail. But somehow, they didn't join anything and they couldn't study. They're saying, sir, we didn't study properly. Can we pass? They can pass. They can pass. In these 15 days, if you start any of your notes, particularly, you have to be selective now in these 15 days. You have to be selective about the subjects. You know very well what subjects are frequently asked in examination. Choose those subjects, start studying, start revising since morning to evening. And one key message from Miss side, you have to re-revise whatever you have revised during the day. That's going to make a lot of difference in the output. And those students who left studies 2 years before, 3 years before, they didn't join anything. Reasons might be any. We are not going in that detail. 2 days before, I made a Ops Kahini video. And many students sent me messages, sir, we left studies 2 years before. We didn't join any institute. And after seeing your video, sir, we think that we can start. And they have started. And they are sending me.
Hats off to you,
They are
sir.
sending me their daily schedules. I told them, study from morning to evening, send me your daily schedule. And I'm guiding them as much as I can. So
That's really
that's
wonderful.
what you have to decide. चाहे तुम्हारी दोस्ती भगवान से क्यों न हो, अपनी लड़ाई खुद ही लड़नी पड़ेगी. अर्जुन की दोस्ती भगवान कृष्ण से थी, तब भी अर्जुन को अपनी लड़ाई खुद ही लड़नी पड़ी. Yeah. Look at this pic. You know this Sachin Tendulkar. Everyone knows. I will just summarize in 1 minute. There was a match in Pakistan, and this young boy, 16 years old boy, 14 years I think, he was playing a match. Vakar Yunus bowled, and it hit his nose. उसकी नाक टूट गई. There were two options in front of Sachin Tendulkar. Navjot Sidhu told Tendulkar, just go to the dressing room. Tendulkar had two choices. Either go back to dressing room or to play. Tendulkar said, I will play. मैं खेलेगा. That day changed the destiny of Tendulkar. Every moment, beta, we are heading towards a destiny. हम हर वक्त एक destiny की तरफ बढ़ रहे हैं. What I mean to say, every time means every moment we are heading towards a destiny. And destiny is never by chance. Destiny is always by choice. In these 15 days, you have to choose what you want. Choose studies. Choose revision. We, Miss Team, is there to help you.
Yeah.
In whatever way we can. And we want all of you to pass. So just say, मैं खेलेगा. I will play.
Wonderful.
I will play.
इससे मेरे को एक बात याद आती है कि किसको क्या मिला ये तो मुकद्दर की बात है. किसको क्या
ऊपर
मिला,
वाले तूने देने में कमी ना की. अब
किसको क्या मिला ये तो मुकद्दर की बात है, लेकिन हम कोशिश ही ना करें ये तो गलत बात है.
ये तो गलत बात है. ये तो गलत बात है. अच्छा, कितनी बार देखी थी साजन? सर्जरी मिस करके, मेडिसिन मिस करके. हाउ मेनी टाइम्स यू सॉ साजन? ओके. Overindulgence into past will create stress. Overindulgence means, sir, मैंने पढ़ा नहीं था. I couldn't study. So why you want to regret for all those things that you couldn't study before? Don't overindulge in the past. You should know the power of optimism. What is the power of optimism? मैं जीतूंगा. मैं जीतूंगा. मैं जीत के रहूंगा. मैं पास होकर रहूंगा. केवल इतना सोचना है, I will pass, I will pass, I will pass. Study, study, study. Be selective. Be selective about the subjects. Be selective about the synchrony, about the schedule, what you are going to study. As Dr. Vineet clearly said, one day before examination, you have to see all the images. You have to go through the staging and treatment of all the cancer. 2-3 days before, you have to go through all the volatile areas. And now, during these days, you know, we have clearly highlighted what subjects are important and what you have to go through. So if there is a direct question from your class note, don't overthink about it in examination hall. As we told you to solve clinical questions, you have to see last 2 lines first. For image questions, you have to see options first. But if there is a question directly from your class notes, then don't overthink and mark the choice.
Yashveer is asking that which subject will be included in paper 1.
Yeah.
So I would just like to tell you, beta, Yashveer, an art physio biochem, patho pharma micro forensic, PSM, and some questions from Ent and Ophthalmology. This is generally the distribution of paper 1, and as we have highlighted earlier, that major chunk is found by PSM, followed by Ent and Ophthalmology, and then comes the weightage of patho, and some weightage of this pharma and micro.
And remaining subjects in second paper. So second paper basically is the clinical paper, majorly by medicine, surgery, obs-gynae, dermatology, radiology, orthopedics, psychiatry, dermatology, anesthesia. Fine. So they are included in first paper and second paper.
Right.
And next is you have to learn to manage the world of emotions. You are passing through a lot of anxiety, depression, mental illness, what's happening these days, what I will do in these 16 days, what I will do in these 15 days. So beta, don't just think what I am going to do in these 15 days. Just think what I am going to do next day. Tomorrow, what I am going to do tomorrow. मैं कल क्या करूँगा? This is very important. What you are going to do tomorrow is the most important thing. And what you are planning for tomorrow, you have to write it in the notes gallery of your phone or in your notebook with the pen. So you are prepared. When you wake up tomorrow morning, you are ready with your target. And by the end of the day, you know whether you have achieved or not. And one small advice from our side, if by chance you are not able to achieve your target, then don't have much of the regret. Just re-revise the things and go to sleep.
Yeah, 25 questions are not enough for passing the FMGE exam.
Yeah.
For this, actually, we need to go into the detailed notes, attend the lectures, and understand the concepts, and then we should be able to apply our knowledge into the clinical concepts.
Take your awareness how we are just discussing how to remember, how to overcome the fear of not remembering the thing. There's a small tip. See, this is a long journey, but for 2 minutes in a day, just for 2 minutes in a day, you can just take your awareness to your breathing. Just look at your inspiration and expiration. It's going to improve your concentration. And of course, you have to re-revise before sleeping whatever you have studied during the day. And stop saying, sir, I didn't study this or I didn't study that. Leave. जो अपना है ना, whatever you have studied, जो अपना है उसी को अपना बना लो पूरी तरह. Don't run here and there. I should go for this notes. I should go for this MCQ book. I should go for this. Just stick to your own notes. Just stick to whatever you have studied till now. This is the time to converge and revise and re-revise that content only. Because that's going to give you a lot of output. Say it is a 300 marks question paper. And how many marks we need to pass the exam? Just 150 marks. Even topper of any exam doesn't know 50 questions. Even topper of any exam doesn't know 50 questions. So don't think that I didn't study this particular topic. I didn't study that particular topic. That's going to discourage you like anything. And unnecessarily you are depressed. See what you have studied. That's going to give you 200 marks or 220 marks. Isn't that enough? Why do you want to score complete 300 out of 300 marks? So don't waste your energy in what you didn't study. Utilize whatever you have already studied and revise and re-revise that content only.
Yeah, I would just like to take a few questions here.
Please.
I think, let me just have a look at these questions. Mandar is asking in paper one, is there any kind of time shortage? I think this is an important question, that time management has to be focused
Very
on.
important. Time management is very important. See, you shouldn't devote much of the time on the questions which you don't know at all. Just skip that question.
Yeah.
Just skip. Don't waste much of the time on that question which you don't know at all. Ultimately, you won't get any output. Just mark anything, just think something and mark anything and move ahead.
I think I would like to summarize what Amit sir has already communicated, that see, there are different type of questions which are going to squeeze your time. The single liner questions, which are directly from your notes, Amit sir has already told, do not overthink, right? Mark them straight on.
If they're from our notes.
Yeah, if they are from the direct questions from the notes, just mark them, don't waste too much of time there. But if there are lengthy questions, suppose non-image based lengthy question, try to read the last line and the second last line of the question first. Look at the options so that you don't waste your precious time in thinking about so many different type of problems. If you start reading the long questions from the beginning, then as you are reading the question, the thoughts are coming in your mind that this can be this, this can be this, this can be this. But what actually we need to choose is one out of the given four options. So it is better that you look at the options so that your mind is focusing only on those four choices rather than thinking about 10 different options. That is the whole story for the lengthy questions. Image-based questions, look at the image, see the options, read the last line of the question or maybe the second last line of the question as well, and then hit the answer. So this is how you will be able to manage your time nicely. And Amit sir, Abhinav is asking for some chocolates.
Yes, definitely. They are due. Chocolate party. Abhinav chocolate party.
Sai is telling about very much fear. We'll come to that again, Sai, that how to control your fear at this point of time. Shreya is asking that she's getting 48% in the missed exams. Now, what she should focus on, what she should do.
See, if you are getting, Shreya, 48% in the missed exams, I would advise you to re-revise your notes. Re-revise your notes, be restricted. Just restrict yourself to your notes. I think you may be moving here and there for some other stuff or some other MCQ. See, missed notes, the notes, you are a missed student, you studied in missed, so missed notes are going to frame the major chunk on 12th of December exam. Most of the questions,
Yeah.
I don't want to say any number, they will be from missed notes. So Shreya, just re-revise your missed notes.
Yeah, I think Ashish has also asked that what subjects to be taken much care of. So Shreya, Ashish, I think let us summarize what we have already said, that PSM surgery, gynae, ENT ophthalmology, anatomy pathology, forensic radio. We have analyzed in detail the input, what you are going to put, and the output which you are going to get. So these are the subjects where you are going to get the maximum output. And then if you feel that you have got enough left out time, then also go ahead with the pharma and micro, right? Though don't miss out on any
The
subject.
volatile areas, and they are incorporated with medicine also.
Yeah.
So you are able to solve good number of IM questions with that.
Yeah. And Ajay is asking for MCQ practice, say something, what should be done? So
So Ajay, see,
Telegram group is
yeah,
there.
the Miss Next Telegram group is there, and today onwards, we have decided after reading lot of messages from any students who couldn't join any institute, today onwards, 9 p.m. onwards, going to put lot of questions on Miss Next Telegram group till your 12th of December exam. They will be the questions which have been framed by respected faculty.
Yeah. So they are going to be high yield questions
High yield
there.
questions.
And
Today
PA,
onwards.
we are really very sorry for the message which you have shared for death, and we just pray that his soul rest in peace. And the thing what you have pointed out is that you know that you have the potential, but you have just holded you back. I would like to remind you what Amit sir said just now, that yesterday he received a message from one of the student after his OBG 25 questions video that he did not prepare at all earlier. But what Amit sir has communicated to him is that these 15 days, you cannot hold yourself back. Just be a fighter. You are just like an army soldier.
And I won't name this. He is with me and he is updating me his daily studies, and I am also trying my level best to.
Wonderful.
Yeah.
So he has asked that particular student to update his daily schedule to Amit sir. Hadia Mushtaq, medicine and ENT. I think ENT, the input-output ratio is much, much better. So just to try to cover as many questions in ENT as possible, read the notes of ENT. And here I would like to make a point. Please do not go for any new content, right? No new content, please. Whatever notes you have read earlier, you have to just revise those notes only, whether it is from MIST or not from MIST. This is for everyone, right?
Wherever you are, just stick to that.
Adya is saying that it's a good idea to study pharma and anat at the last, as they are volatile. In last, how much day before? Adya,
Clinical anatomy.
clinical anatomy, pharma, 9th and 10th of December. That would be the best thing. Micro, I think micro again, 9th and 10th of December. You have to just mark the highlighted points there and do revise them on 9th and 10th of December. Paper 1, I think we have talked about. Miss 2021 notes in the Telegram. When the free mock test for MIST will be available. Okay, so this is a good suggestion from Sahil. Sahil Soni is asking for a free mock test. So let us, if you permit, we can just go ahead.
Yes, definitely.
So we can go ahead with a free mock
Free
test.
mock test. We'll
The
go ahead.
team, the admin team, please take a note of it, that we will be organizing a free mock test, most likely on 6th or 7th of December.
Yeah.
Anupama, sir, can we skip question that we didn't know and come back later? Yeah, you can do that. You can just flag that question for review, and you can come back to that question later on. Deven is saying, I didn't complete ENT and more 1 to 2 subjects, and I'm thinking about completing it. Is it a good decision? So I think
Didn't complete ENT and more 1 to 2 subjects. I'm thinking about completing it. Sir, is it good decision? Go through the notes quickly.
yeah.
Go through these notes quickly, actually.
You can do it. You can do it.
Go through the notes quickly. Yeah.
Which MCQs to do for passing? You can just have a look at the
Be selective about the subjects.
the subjects which you have already focused on. That would be the best thing.
Yeah.
Right.
So there's a PCD formula. This PCD formula is practice, consistency, and dedication. Practice you have been doing for last many months. Now in these 15 days, be consistent and be dedicated. Consistent means make daily targets and achieve those targets from morning to evening. And you have to be utmost dedicated for it. Preparation is equal to priority plus planning. Priority means you have to be selective about the subject. You have to prioritize subject, which you know, which are high yield subjects, which give you more marks, and plan this according to, as Dr. Vineet said, what should be the synchrony, what should be the strategy in next 15 days. And remember, you have been watching IPL, Indian Premier League, but in these 15 days, you are passing through Indian Padhai League. This is not Indian Premier League, this is Indian Padhai League. And in this IPL, which is Indian Padhai League, you are not going to do batting like Pujara or Rahul Dravid. You are going to do batting like Chris Gale. Just become Chris Gale in these 15 days in this Indian Padhai League. Remember, beta, these 15 days, IPL is Indian Padhai League, and you have to be Chris Gale. You have to be Kapil Dev of older times. Fine? Mahendra Singh Dhoni. And come out of your anxiety, mental depression, and illness. See what happens. We are studying, we are revising, and there's a mobile with us. And if some notification comes on mobile, the notification can change our emotions. You should know how to manage your emotions. That notification may change your emotions, and unnecessarily you may become sad or depressed. So you have to do a sacrifice of social media. You use your social media if you have to see your daily class updates or revision updates at a particular time. Use Telegram for poll questions at a particular time. This is why I post only at a selective time, 9 p.m. This is the only reason, because students have acclimatized that Amit sir posts at 9 p.m. So they open the Telegram, those students who want to see my questions at 9:15 or 9:30. So use it for some time only. You have to sacrifice, sacrifice thing. राम राजा तब बने जब उन्होंने sacrifice किया, जंगल गए. कृष्ण तो पैदा ही जेल में हुए थे. Then everyone has done sacrifice. So these 15 days, beta, they are for sacrifice. Sacrifice lot of things to achieve something very concrete and fruitful. एक बहुत अच्छी बात बताता हूं हिंदी में. अगर पढ़ाई नहीं की किसी भी वजह से, तो जानता हूं तुम्हारे अकेले की गलती नहीं. If you couldn't study due to any reason, it couldn't be your mistake only. Maybe there were some family reasons, some emotional reasons, some social reasons. लेकिन अगर इन 15 दिनों में नहीं पढ़े तो इसके जिम्मेदार तुम खुद होंगे. But if you don't study in next 15 days, you solely are responsible for it. Because in these 15 days, we are telling you to pick up the subjects and just revise. And we are with you all. Those who couldn't study for last 3-4 months, we are with you.
Wonderful. And there are a lot of queries which I would like to discuss with sir.
Yeah.
That what should be done if we are not able to mark the correct answer when we are getting confused between two options?
See, if you are able to eliminate two options, then you are just close to the victory, because you are left with two choices only. Just follow your inner instinct. अपनी आत्मा की आवाज सुनना उस वक्त केवल. Just listen to your inner instinct and mark that choice. That would be the correct choice in 95% of the cases.
Absolutely correct. And one more thing which I would like to answer here, that many a times the students are writing that they mark the correct answer, but then the thought comes to their mind that this is not the correct answer. They change the answer and actually they land up in marking the wrong answer.
Yes, that's what happens actually, because they are not following their inner voice. अपने अंदर की आवाज को सुनना भी सीख. जो तुमको तुमसे बात करना सिखा दे, वही तुम्हारा सबसे अच्छा दोस्त है. तो याद रखो, 2 minutes, just for 2 minutes, take your awareness to your breathing. You are going to find a friend or your inner voice within you only, which will guide you to mark the correct answer in examination hall. See, everything is about concentration. Why we are deviating from this choice to that choice in examination hall? Because we lack concentration. We lack confidence. So these 15 days, beta, these 15 days, this is Indian Padhai League. This is IPL of your FMGE exam. So what you have to do in this IPL, it's not only about doing batting. You have to see the swing of the ball. You have to see the spin of the ball, how the ball is spinning, how the ball is swinging. So bet accordingly. Accordingly, you have to choose the most appropriate answer.
I think I just lost that.
Yeah.
Hariom,
एक मिनट.
just let me see the chat of the students.
Chat.
So another important question what is coming up is that how to control that fear of not able to remember. I would like to specify here that this is something which is very natural. We all are human beings, and for a human, it is something which is very natural that we are not able to remember 100% of things, right? Now, how to improve that remembering power? For this, I would just like to tell you that more number of times you turn the pages. I repeat, beta, ध्यान से सुनेगा. More number of times you turn the pages, the probability of remembering those missed points will be more. That is why Amit sir emphasized that re-revise before you go to sleep. Also, whenever this is happening in particular topics or in a particular area, try to learn that quickly, try to revise that quickly, and then give it multiple turning of the pages, at least quick revisions, right? That multiple revisions are going to help. Just keep yourself focused on the daily journey rather than thinking about what destination you are aiming for, whether you have reached to your destination or not. No, destination is something which we are not targeting. We are just focusing on the current journey that we have to grind it, grind it, grind it, grind it. Our job is to just keep working as hard as possible, as much as possible, and we will keep on doing that till 12th of December.
Bharat is asking, Bharat Jangel is asking, sir, prep letter में टेस्ट दिया हूँ तो मार्क बहुत कम आया है. I missed my test. We are organizing a free mock test also,
Everyone.
so you can appear in missed test also to boost up your confidence.
And this is something which is going to give you a feeling that you are able to remember better if you are looking at those pages multiple times. Okay, so this might help you. A small suggestion from our side. Now, any more questions? Yeah, I'll just take a look at some of the questions. A lot of questions again and again regarding paper 1. Paper 1, beta, Anat Physio Biochem, Pathopharma Microforensic, PSM, and questions from ENT and Ophthalmology. Though few questions of ENT and Ophthalmology will also be there in paper 2. इस बार पेपर कैसा आएगा, मुकेश? Neither I know about it, nor sir knows about it. To be very honest, we don't know how the paper is going to be. We just pray to God that whatever you have studied, just keep on revising as hard as possible, as much as possible, and we just pray to God that may all of you pass this exam. Then Ajay, it is your first attempt. First attempt, I feel, is the best attempt, and you should just keep on fighting like a warrior till 11th of December, and definitely you are going to crack the exam. Own book notes of missed. Own notes. Notes are going to be the key, beta. Srishti, you have some problems. Due to that, I have to maintain 8 to 9 hours sleep, and I'm not able to revise more in a single day. Doesn't matter, beta. Sleeping for 8 to 9 hours is something which is not uncommon, but because you have some problem, it is absolutely okay. But try to utilize the rest 15 hours in a judicious manner. बिल्कुल सही बात है बेटा. हमें किसी को नहीं पता होता कि पेपर कैसा आएगा. हमें सिर्फ अपनी मेहनत पे विश्वास रखना होता है और पूरी हिम्मत के साथ, बिना दगे, बिना हिम्मत हारे अपनी मेहनत करते जाना है. रिजल्ट देना उसके हाथ में है. रिजल्ट कभी भी हमारे हाथ में नहीं है. हमें सिर्फ अपनी मेहनत पे भरोसा होना चाहिए, विश्वास होना चाहिए. Anupam will definitely share the mock test, that how you can give the mock test. We'll definitely be informing the team, and we'll be putting that on social media, YouTube and other social media platforms. Another important question, Amit sir, is that Avni is asking that while doing the subject-wise test, if some questions which I don't know comes, it is taking away my confidence and I'm not able to focus on the rest of the questions. अगर एक सवाल मेरे को नहीं आता तो मैं बाकी confidence lose कर रहा हूँ.
That's what we just discussed. That जो अपना है उसी को अपना बना लो. See, even the topper of any exam doesn't know 50 questions.
Absolutely.
So if you know 250 questions in a question paper, 250 questions out of 300, if you are able to solve 300 questions, क्या तुमको मुकुट लगा के लेके जाएंगे? Yeah, when you will go to NB to take the certificate, will they do a red carpet welcome? No. So 250 is enough, I think.
Yeah.
250 is fair number. If you are able to score 250, it's fair.
Yeah, but Beta, the question what you have asked is that you are losing your confidence when you are attempting more questions. So just follow what Amit sir has said. Ki, do not try to achieve 200% or 100%, right? We know that there will be certain limitations. We just need to focus on each question one by one. Every question has got equal marks. There is no negative marking, beta. If one question is gone, don't worry. Let us just
You can
forget
get
it.
a very simple question. Next question may be very simple question.
Yeah,
Next to next may be a very simple question.
Yeah.
So don't waste much of the energy on the question which you don't know.
Ravi, the approximate number of images, we expect approximately 40 to 50 images should be there in the exam at least. They may be, at times we have seen even more than 100 images in the exam, right? So the distribution may vary, but minimum 40 to 50 and maximum there can be 100 even. Can we get revision videos? I think this you can
They are
talk to-
available in app only.
Yeah,
actually,
you can
but-
talk to the admin team and they can guide you because we are not very clear that what is available at what
Yeah,
prices
because
and
we
all.
are focused on this exam only. Right?
Yeah, our main focus, me and Amit sir, we just try to
We are
focus
focused
and
on
the
12th
entire
December exam
faculty
right
team.
now.
We just focus on the academics. Practice MCQ test. Hemnath, third attempt, got 142 and 140. Don't worry, Hemnath. 142 and 140 is not a bad score, beta. Nobody gives you 140 marks just for free. You have already worked very, very hard. Now you have again worked hard. Just utilize these coming 14 days to the maximum potential. और ये 14 दिन ऐसी मेहनत करके दिखा दो कि दुनिया तुम्हारा करिश्मा देखती रह जाए और विश्वास करो कि तुम डेफिनेटली अगर ये 14 दिन अच्छे से इस्तेमाल कर पाए तो तुम कोई ताकत नहीं जो तुम्हें पास नहीं करा पाए. Just believe in yourself. Manish, how much time we get in between exam and what should we do in that? 11:30 to 2 p.m. is the break time. You come out of the examination center at 11:40 a.m. You go back into the examination center at 1 p.m. So you are getting 1 hour, 20 minutes in between. Focus on the images and the single liners. For question, Shubham is asking that for question which he has never seen before, what should be done?
The question which he has never seen before, Shubham, it means you have never seen that topic before. Just think coolly and whatever comes to your mind, just mark that.
Yeah, the most beautiful answer.
The most beautiful answer, as our lovely Dhawan sir used to say,
Yeah.
mark the most beautiful choice.
As Dhawan sir is always saying that you would be
Mark
getting,
the most beautiful choice.
like recently he conducted a session where he said about the Ragda Petty.
I really love his Ragda Pettis
Yeah,
syndrome
that, that was really wonderful.
Dhawan sir's Ragda Pettis syndrome.
Yeah,
So just consider that as a Ragda Pettis.
and even that Milad Gobler syndrome or something like that. Just mark the most
Just mark
beautiful
the most
answer.
beautiful choice.
Yeah. And Radha, we will pass. Yes, Radha, we will pass. Nobody can beat us. Where to give mock test? I think I have already. Mukesh Bishnoi, I think I have already. I don't know what is this. PDR generally, the number of questions are less. Jethu, you are not having too much of confidence in surgery. I would just like to tell you at this point of time that whatever notes you are following for surgery, stick to those notes at this point of time. Do not read any new content and just try to solve MCQs in reference to those notes, and that will help you a lot. Abhishek is asking whether we should focus more on solving the MCQs or more on notes.
See, what is the source of MCQ? Source of MCQ is notes. So you should be thorough about notes, then only you can solve MCQ. But during these 15-day times, as we discussed earlier as well, particularly 1 hour between 9 a.m. to 11:30 a.m. and 2 p.m. to 4:30 p.m., utilize that time, at least 1 hour from that time, to solve MCQ. So you will be oriented and you will be acclimatized of solving MCQs coinciding with the examination time. So particularly at that time MCQ, but see, notes is the key.
80% of the time should be devoted for notes.
For notes.
And 20% you can
For
devote
notes.
for the MCQs. Surgery and gynae, we have already said that PSM surgery and gynae, you would be having
Going
approximately
to
100
make
questions.
the major chunk of examination.
Yeah. Okay, we'll be conducting a live chanting session also for you before the exam in the month of December. Rizwana, your exam is in June, but you are worried about December exam. Best wishes to all. So, my dear doctors, Rizwana is preparing for June, but has wished all the best for all the FMGs who are appearing for 12th of December. Thank you so much, Rizwana, for motivation of our students, those who are appearing on 12th of December. Blue highlighted subjects, you can give less importance because the input-output ratio, input is more, output is less. Aryan has rightly said, मैं हर बार हार के भी मुस्कुराया हूँ ए जिंदगी, मैं तुझसे फिर लड़ने आया हूँ. What is it?
Yeah, but
I think
anyways,
मैं तुझसे फिर लड़ने आया हूँ. We all will pass. Definitely, beta, you all will pass. Preeti, if you are scoring 60 to 70% in the MIS test, but you're not a MIS student, I think that's a good score, and you should just continue that. Yes, so notes are going to be the
major source. Okay.
wonderful.
So can I solve MCQ in pre-PG app? You can solve MCQs in Miss Next Telegram group, which we are going to increase the number of questions substantially today onwards. And they will be of all the subjects.
Cha. So I think, yes, this is, we have already spoken about, re-revise, look at the pages as many number of times as possible.
Yeah. Fine. So we have a deadline of 15 days. In these 15 days, our target is to pass. और हमारा निशाना कभी
चूकता नहीं और हम सब पास
होंगे
कोई
हम
दुनिया
सब
की
पास
ताकत रोक नहीं सकती
होंगे।
हम सब पास होंगे
Wish you all the
All the
best
best.
from entire
MIS
team.
God bless you all.
God bless you all.
Wish you all the best.
Wish you all the
Thank you for your patient listening. Thank you.